Another topic for today is Bell's palsy. Actually, Bell's palsy is a facial paralysis or seven nerve paralysis. It is considered to be an idiopathic facial paralysis. That means the etiology remains unknown, but several theories are proposed. First one is trauma to the facial nerve. Second is injection of local anesthetic to the nerve. Also, the ischemia of the nerve near stylomastoid foramen. This will cause edema of the nerve, again compression of the nerve, and finally resulting in paralysis. Another etiology is the surgical removal of parotid gland. Also, it can be due to hereditary reasons. Again, reactivation of herpes simplex virus or herpes zoster in geniculate ganglia. Also, multiple sclerosis. It's a condition where nerve demyelination occurs. The predisposing factors for Bell's palsy could be acute otitis media, atmospheric pressure changes while diving and flying, exposure to cold, local or systemic infections, or early eclampsia condition in third trimester of pregnancy. It's a condition where there is a high blood pressure in the pregnancy period. When you see the clinical features, there's no any age predilection. Women are more commonly affected. Children also affected since they are more prone for infections like viral infection, sarcoidosis, and Lyme's disease. Unilateral paralysis of the facial musculature present. Rarely, the condition is preceded by pain on the affected side, particularly involving ear, temporal region, mastoid area, and ankle of the jaw. Paralysis is manifested by drooping of corner of the mouth, drooling saliva, and inability to close eye, which will lead to eye infection. When a patient smiles, the paralysis becomes obvious since the corner of the mouth does not rise, or the skin of the forehead does not wrinkle, or the eyebrows does not raise. Also, the patient has a mask-like appearance or expressionless face. There will be difficulty in speech and eating. There will be altered taste sensation, and the condition will regress within weeks or months. Bell's palsy is associated with a syndrome called Melkersson-Rosendahl syndrome, and it is a triad of Bell's palsy, cheilitis granulomatosa, which is an inflammation of lip due to granulomatous inflammation, and the third one is fissure tongue. Treatment for Bell's palsy can be done by giving histamines, systemic corticosteroids, hyperbaric oxygen therapy, and surgical decompression of the nerve. For eyes, we can give topical ocular antibiotics and artificial tears. Another type of nerve disorder is causalgia. It's a term applied to severe pain that occurs after an injury to the peripheral sensory nerve. Rarely, it is reported as a post-extraction pain, mainly after the extraction of multi-rooted tooth or traumatic extraction. Clinically, the pain will be burning type and localized. Heat, cold, or touch or emotional disturbances may aggravate the pain. Treatment, actually it's difficult, but resection of the nerves can be done. Post-herpetic neuralgia is another type of neurological disease. It's a reactivation of varicella zoster infection. 15% of the affected patients will have post-herpetic neuralgia. It's more commonly seen in an age group above 60 years. Pain will be burning, throbbing, aching, itching, or stabbing type. It may involve any nerve, more commonly ophthalmic division of trigeminal nerve. Skin lesions prior to the onset of neuralgia can aid in the diagnosis of post-herpetic neuralgia. Treatment run by analgesics, narcotics, anticonvulsants, and antidepressants. Fry syndrome, it is also known as auriculotemporal syndrome. It occurs due to the damage to the auriculotemporal nerve and subsequent reinnervation of sweat glands by the salivary fibers. It arises as a result of removal of parotid gland tumors, thereby damaging the auriculotemporal nerve. In this condition, the patient exhibits flushing and sweating on the affected side of the face while eating. Crocodile tears is another similar condition. It follows the facial paralysis after a Bell's palsy or after a herpes zoster infection or even after a head injury. In this condition, the patient exhibits profuse lacrimation while eating. It is considered to be a salivary lacrimal reflex arc. Next is burning mouth syndrome. Usually, burning sensations accompany many inflammatory or ulcerative diseases of the oral mucosa. The term burning mouth syndrome is reserved for describing the oral burning that has no other detectable cause. Burning sensation of the oral mucosa is seen with no clinically apparent alterations, no mucosal lesions or neurological disorders to explain the symptoms. It has got three categories: type 1, type 2 and type 3. In type 1, symptoms are not present upon waking and then increases throughout the day. In type 2 cases, symptoms upon waking and continue throughout the day, and it is the most common type. Type 3, no regular pattern of symptoms, and it is the least common type. Here also the cause remains unknown, and a number of factors have been suspected: hormonal and allergic disorders, salivary gland hyperfunction, chronic low-grade trauma, psychiatric abnormalities, vitamin deficiencies, AIDS, medications like ACE inhibitors, xerostomia, mouth-breathing habits. These are all factors suspected, but pathophysiology remains unknown. When you see the clinical features, tongue is the most commonly involved site. Burning sensation seen on the dorsum of the tongue, highest at the anterior one-third, less commonly seen in palate, lip and alveolar mucosa. We can describe the feeling as burning, scalded, tingling, tender, discomfort, annoying, irritated or raw feeling. Rarely pain occurs. Dysgeusia or dysesthesia, that is distortion of taste, occurs. Other mucosa like urogenital and intestinal may be involved. Associated factors are anxiety or depression. Exacerbating factors are tension, fatigue, speaking, hot, acidic or spicy foods. Relieving factors: sleep, cold, eating and drinking. Other causes of burning symptoms of the oral mucosa must be eliminated by examination and lab studies before the diagnosis of burning mouth syndrome can be made. Hence, the burning mouth syndrome involves glossodynia, glossopyrosis, that means red and painful tongue, stomatodynia and stomatopyrosis, meaning painful and red mouth, also cancerophobia. The patient should be reassured of the benign nature of the symptoms, and the patients with symptoms that are more severe often require drug therapy. We have completed the topic. Thank you.